Hello everyone, welcome to the class. We're gonna do mind aerobics today. We're gonna talk a little bit about successful aging, what contributes to successful aging, right? Because when we're talking about that, it's very important that we take a holistic approach and pay attention to various factors that contributes to that, right? Like physical health, emotional health, socializing, cognitive health, right? So what is cognitive health? Why it's and why it's important? Cognitive health? Anyone? Yeah, thank you.
Cognitive health, it just means, how well your thinking process is. What your capabilities are and aren't as far as understanding and reasoning.
Absolutely. How do you remember? How do you process information, right? Thank you so much. So, cognitive health. Also, we have so many ways that we can improve cognitive health, right? So, anyone can give me examples? What can be done? How we can improve cognitive health? Yes, please.
Attend this class.
Oh, yeah. Thank you so much. Absolutely. Mind aerobics. Okay.
That's right.
What else?
Exactly. Doing crossword puzzles helps to stimulate the dendrites.
Thank you. Thank you. Yeah.
Reading.
Reading. Absolutely. Very important.
Exercise is very important.
Absolutely. You're absolutely right. An extensive body of research found that it's related, and if you exercise, you could improve your cognitive health. Absolutely. Thank you for your comments. How about learning new things? Yeah.
We're learning every day. Everything new day.
That too. Thank you. Thank you. Any examples?
You had another? You had?
We have.
Did you say every day?
No.
No, I thought
You
I heard.
always, you always learn something new.
Yes.
Even that you.
It's important to
Yeah.
learn new things at any age, right? Any examples of how learning new things could be good for your cognitive health? How it can improve your overall functioning?
Good eating habits, certainly.
That too. Thank you. One of the factors that contributes. Thank you so much. Yes, adequate rest, good night's sleep. But what about learning new things and how it could improve your overall functioning? Any examples? Someone was learning something new and how it affected their living?
What about games like Rummy Cube? It's good for the mind.
Come to the book club.
Come to the center.
Book club discussions.
Socialize.
Yes.
Come to
Reading.
the center here and associate with everybody. Everybody, we work together and do things together here. Everybody like
Absolutely.
family.
You socialize. You get support. It's very important too. Yes.
Don't laugh. I remember all the states and their capitals. And when I have a chance, I sit down and I list them alphabetically.
Wow.
And you'd be surprised how this is good for your head. It's something that's a little out of the ordinary, but when I used to work and my boss would get on the telephone, I would sit there with my STEM book and just to keep myself alert, that's what I would do. Because they could be on the phone for a long time, you were sitting there doing nothing. I mean,
Yeah, mental health, yes.
Come back.
Oh, come on, I was resting.
A lot of cameras and cameras. Yeah, I don't know why. Are you coming or are you staying home? Oh, good, okay. Might as well. I'll talk to you later, okay? Why? Why? So you pass on it.
Say hello to us.
You pass on it. You pass on it. That's the big deal. Why? You can't say, what exercise? You pass. You have to go?
No, but I took
I know that, for that reason, but why'd you wanna go to the exercise?
I'm gonna leave at 1:15 because I wanna work lunch. So you wanna come when I get up, we'll go out together?
I got early lunch down here.
Yes.
You got it?
I don't have early lunch, I wanna work lunch.
She's a volunteer. She's gonna go to the early lunch, she's a volunteer.
When it's time, you get up, we'll go down together.
The main floor.
Yeah, second floor.
No, second
Second
floor.
floor.
To the lunch.
Right. That's what she's saying.
Oh, yeah? Where
She's
was
here
she? Where is she? Where is she?
Hello, hello, hello.
It's working. All right, whenever you're ready.
Okay. Good morning, everyone, and thanks for visiting the Council Center. We really are happy to have you here. My name is Gary Levine, and I've been a member here since 2014. Okay, let me tell you a little bit about myself, okay? I'm a retired father of 2 daughters, both of whom work for the city, by the way, and some people here may even know her, but okay. Also, I'm a Vietnam veteran. I've spent my entire life in New York City. I was born in Brooklyn way before you were proud to be born in Brooklyn. You know, when Brooklyn was a bad joke on the late night programs. Anyway, okay. My wife Carol and I have lived here in Midwood, right around the corner from the center, for over 30 years. And the last 6 years, the center has become an essential part of both of our lives. See, I'm turning 75 years old this May. And let me tell you, thank you, may you all live to be 75 at a minimum. Okay, and let me tell you, getting old is not easy, but it does beat the alternative. Okay, being a senior citizen in our society is not the panacea that people may think it is. We don't just sit around playing bingo, by the way. By the way, I hate bingo, okay? Too often, we bear the brunt of ageism, and we're neglected, or worse, we're treated like children. Anxiety and depression are commonplace, and suicide is incredibly high amongst senior citizens. It's very difficult to make new friends when they quite literally, and I mean this, they may quite literally be here today and gone tomorrow. It's hard not to become philosophical about life and question your mortality. But being a stone's throw away from the center and all the services it provides has been an incredible blessing for myself and my wife Carol. Around 2 years ago, TRIO was brought to the center. At first, it was a once-a-week open group session with social worker Jean Wynn. Then there was the REDS program, which helped seniors with depression. Now, after a few months, Jean suggested that I might benefit from individual therapy, and I've been going ever since. My wife and children say that I am a calmer, happier person, and a lot has to do with Jean and the TRIO program. Last April, I underwent quadruple cardiac bypass surgery. Jean helped me get through the emotional trauma of the surgery as I started my physical recovery. I truly believe that these sessions, which were provided by TRIO, have had an extremely positive effect on the lives of all the seniors who have participated in the program. Today, I volunteer at the center and I lead 3 classes. Thanks to TRIO, I'm trained in what they call mental first aid, where I learn skills to help deal with those who may be struggling with their mental health. Not only have I become more patient and understanding when encountering individuals with possible or worsening mental issues, I'm also reassured knowing that there are trained TRIO people here around to deal with any crisis that may arise. And occasionally, they do. So thank you, Jean, my therapist. Thank you, TRIO. And thank you, Ms. McCray, for launching this program and making sure any senior who is struggling has access to the mental health resources that they need. Thank you. Okay. Now, and this truly is a pleasure, now I have the honor of introducing to you New York City's First Lady, the first person who made this all happen, Chirlane McCray.
Thank you so much, Gary. I could not ask for a better introduction. And it brings tears to my eyes to know, I know, and it makes me so happy to know that these services were here and available for you and for so many others. Good morning, everyone. Good morning. Good morning. I am delighted to kick off our Thrive Works tour here along with Susan Herman and Karen Resnick. I guess go back in there and do some more warm-up exercises. Susan is only 4 weeks on the job, and already she is doing excellent work leading the Office of Thrive NYC. I want to thank you, Dr. Riola, the Consul Center team, and all the members who welcomed us here today. Thank you, Acting Commissioner Resnick and the Department for the Aging team for all you do to help New Yorkers age with dignity. And thank you, Gary, for taking mental health first aid and sharing your story and experiences with us. I hope it inspires many more people. Now, we just sat in a session, a great session of mind aerobics, my first time doing it, and let me tell you, it is an activity that helps improve brain health. I'm going to, actually took my sheets, I'm gonna work on them at home. I'm a little warmed up and ready, so let me tell you about what we're doing here. Thrive NYC has brought these kind of structured, evidence-based activities to 20,000 people in senior centers throughout the city. Just as walking and swimming are important for our bodies, brain exercises and social engagement can help improve our mental health. Thrive NYC also made possible the support and counseling that Gary and so many others have received here. We are promoting emotional wellness among seniors and providing care in a place where they feel comfortable. We can and we must do both. Today, I am proud to announce that we will expand Thrive and DFDA's award-winning Geriatric Mental Health Initiative. Currently, this program serves 25 centers across the 5 boroughs. Our additional $1.7 million investment in the next fiscal year will help us serve up to 25 more centers. That means we'll be screening more centers for mental health conditions, getting them the treatment they need, and mitigating risks to their well-being. There are mental health risks at every stage of life. And we know what some of those risks look like as people get older. Loneliness and social isolation can lead to depression and anxiety. So can the grief and trauma of losing a partner. Elderly men complete suicide at a higher rate than any other age group. Chronic illnesses like Alzheimer's, Parkinson's, or arthritis can trigger symptoms of depression. I remember vividly how hard it was for my own mother when my father was diagnosed with prostate cancer. At centers served by the Geriatric Mental Health Initiative, 43.2% of the seniors screened have some type of mental health condition, a higher rate than what is reported for seniors nationally. Historically, most people have not received the care that they need. The stigma is powerful, and there are many other barriers that keep people out of treatment. Barriers like cost, inadequate insurance coverage, transportation, language, and a lack of knowledge about what their symptoms even mean. For every risk, there is an opportunity to overcome those barriers and reach people with connections to care that they never had before. For more than 2 years now, Thrive NYC has seized those opportunities at senior centers across the 5 boroughs, including right here at the Consul Center. Our approach is working. As of January, nearly 1,700 seniors have been assessed by mental health clinicians, and nearly 700 have received mental health treatment on site at senior centers in their communities. Seniors in treatment for anxiety at these centers have seen a 65% improvement in their symptoms. For depression, they have seen a 56% improvement. In the next few months, an independent evaluation of the program will tell us even more about how clinicians have changed the lives of the seniors in their care. Now remember, mental health treatment often looks more like treatment for chronic disease. As with treatment for asthma or diabetes, a person will sometimes take steps forward and then occasional setbacks. The goal is healthy management of the symptoms of disease and changes in feelings and behavior that make a huge difference in someone's ability to live, love, laugh, and learn. That can make outcomes more complicated to track, but improving a person's quality of life is worth the work. A member of one of our centers, Ms. C, would certainly tell you that. Now in her early 80s, Ms. C has struggled with chronic mental illness since her early 20s, cycling in and out of psychiatric hospitals. She goes to an outpatient psychiatric clinic to manage her medication, but she had trouble getting the psychotherapy that she needed. That is until 2 years ago, when Ms. C began weekly therapy at her local senior center. She said she was feeling isolated, living alone, and her therapist observed the symptoms of depression. Ms. C and her therapist worked together to set goals for building and maintaining friendships, something that her condition has made difficult over the years. And this year, she took a vacation with a friend, her very first since her diagnosis more than 50 years ago. Despite some of the challenges and setbacks along the way, Ms. C felt proud of how she managed herself socially, emotionally, and financially. It was a big milestone for her, and it would not have been possible without the counseling supported by Thrive NYC. There are many more stories like hers and Gary's, and with today's expansion of the Geriatric Mental Health Initiative, we will help more seniors along their journey to mental health and wellness. With that, we're happy to take some questions. On topic, please, from media only.
I guess if you could talk a little more, Madam First Lady, about this Thrive Works tour.
Yes.
You said you're kicking that off, so can you tell us a little bit more about that and what is it that you are trying to accomplish?
Well, our goal is to travel around the city, go to programs like this one, and show you what Thrive is doing in the places where Thrive is happening. Show how people are being helped. So instead of, we can give you statistics and numbers, which we're doing, but I think it helps for you to see the faces of the people who are being helped and hear their personal stories, because that is at essence what we're trying to do. We're trying to help individuals, a lot of individuals who've never received help before, people who've been isolated, people who are in pain, and would benefit so much by just having the kind of care that we give people with other diseases. So we're going to continue this tour over the next week or so, and I hope you'll join us.
Response to some of the recent attention that has been put on Thrive over whether it's a program that is working and producing results, and are we going to be seeing more than these? Is it going to be like this, like a visit to a center to see what kind of services people are receiving?
Well, I have to tell you that before we launched Thrive, we spent 11 months visiting senior centers, talking to parents, talking to clinicians, going to schools. I mean, we spent a lot of time talking with people about what their needs were, what their experiences with mental health and mental health services were. And, it is part of the growing up of Thrive to now revisit the places where we were. I was here 2 years ago. I want to go back to some of those places before Thrive to see what kind of difference we're making, how we can improve the programs if necessary, and make sure that we're on track.
Is this going to extend to other agencies, not only seniors, but...
Oh, absolutely. That's right. Thrive, we have more, I think we have roughly 20 agencies that that have Thrive programs under their umbrella. So we will be visiting all types of programs, working with different populations.
Hi, yeah, so some questions have been raised about the efficacy of the program, and both on retention but also on measuring the results. Do you want to take on some of those questions specifically? Do you think the program's working? Do you need to do a better job of measuring the impact?
Oh, I think the program has been wildly successful. Programs like this have exceeded our expectations. Some programs need some more work. We're doing something that is brand new, but obviously there are people in pain. We know that 1 in 5 people suffer from a diagnosable mental health condition, and we have not had in the past ways to connect them to care. We have more than 400 metrics measuring our programs. Obviously, as the program, we've only been, and not all of our programs have been in effect for 3 years, but as they age, we will put even more metrics in place. In the meantime, we want you to see for yourself what Thrive is doing and how it's making a difference in people's lives.
Can you give an example of a metric? Can you share a metric that tells you that it's working?
Yes, well, I can give you a few. I want you to know that right in our senior centers, we know that, and I think I actually announced that number, seniors in treatment for anxiety at centers like this have seen a 65% improvement in their symptoms. Seniors who have experienced depression have seen a 56% improvement in their symptoms. We have other statistics. We have other statistics as well about our other programs. For example, Gary talked about taking mental health first aid. You may have heard that we have trained 100,000 people in mental health first aid. It's made such a big difference in so many people's lives. 80% of mental health first aid trainees have used their skills to help others. Now that shows that Thrive actually has a multiplying effect, that people who learn these skills, who gain these skills, actually go on to help their family members and their friends.
A number of the programs that you give funds to, like high needs high schools and so forth, they haven't spent any of the money yet over the past 3 years, and I'm wondering, but they continue to receive money. I'm wondering why, if programs that aren't spending it, why do they keep receiving?
We can give you specific answers to that question offline. I don't have the, I need to know the specific schools you're talking about. But I can tell you that Thrive, we will have spent $560 million by the end of June. So, all the money is not spent. I mean, people talk about the $1 billion that's been allocated. Only $560 million has been spent to date as of the end of June. Next.
Last week, the city reported that Thrive is struggling to retain clinicians for its mental health service corps, and that the program is going to see budget cuts in 2020 and 2021. Is the program being scaled down to address the retention problem?
We are trying to put services in places where the need is greatest. That is so important. Some of you may have heard the statistic that I often use, that we've got 1 psychiatrist for every 1,300 residents in Manhattan, but only 1 for every 13,000 in the Bronx. Well, that's just one example of the discrepancy and services that are available to people. So what we've done with the Mental Health Service Corps is actually place folks in neighborhoods where they, often where they speak the language, where they know the culture, they know the neighborhood, and the sites have been very grateful to receive these folks who are graduates of master's programs. Some of them are physicians. They get additional training from us and mental health first aid and other mental health resources, so that they're able to go into these locations and get their clinical hours, but also be of service to a primary care physician, for example, who may not have had those kinds of services available to her or him. Now, these are trainees. They're getting their clinical hours. This is was not presumed to be a long-term program. We are not supposed to stay forever. That being said, we're doing more to make sure that the sites are a good match, because some of our sites, they've never worked collaborative before. We want to make sure that they're ready for that kind of relationship, and that takes time. We're working on it. I can tell you that there is a demand for these service corps members, and that the corps members themselves, and I've sat down and talked with them, they're just amazingly enthusiastic about the program. They think that it's filling a gap that has been in our city for far too long. Wait, one more. Somebody who just press, right? No. You're not media. Okay.
Do you operate in New York City shelters or the correctional facilities of New York?
Yes, we do. We have counselors in our shelters and in our correction facilities as well. Family shelters.
Given the emphasis on geriatric mental health today, geriatric mental health has received a relatively small allotment of $7 million over the past 3 years. I'm wondering, why that is, just given today's,
I think you could almost say that of all our programs. Why are we not giving them more money? Well, because first of all, we're being criticized for giving them a small amount of money, but more importantly, because we didn't want to just throw money at something we knew would be good. We wanted to start in areas where we knew it was needed most, make sure we have a good partnership relationship with the administrators of the program, and then grow from there. This expansion that I'm announcing today will go to centers that have expressed a need, where we've seen there's a tangible need, and where there's space for clinicians, like a private, they have a private room to practice. Not every center can accommodate this kind of program. We want to make sure it's a good fit.
Some of the stats that you mentioned, 65% improvement in seniors reported an improvement in their symptoms. How did you go about tabulating those stats, and is that something that you're doing in other parts of Thrive? And I just want to clarify, is the geriatric service a new thing within Thrive, or that was already in place?
It was in place, but now it's being expanded. And I would like you to speak to a clinician to talk about those measures. I'm not a doctor. Okay. And yes, we have them here.
Sure. Joanne? Yes. Yeah. So, just introduce yourself first. So, hi.
Come to the mic.
Come to the mic. Hi, I'm Dr. Joanne Sire. I'm a clinical psychologist at Weill Cornell Medicine. And thank you, Gary. I'm the director of the TRIO program, which is really a Thrive NYC initiative that's been here at Council Center. Really happy to be here. We've been here for two and a half years now. So, but I can answer some questions if that's helpful.
Collected the data to track that there was an improvement?
So actually, the screenings that we do, which were designed by DIFTA, include a PHQ-9, which is the standard depression screening, the GAD-7, which is a standard anxiety screening. And what we do is we screen people, and people who have demonstrated need are offered mental health services here. And then we re-administer the PHQ-9 and the GAD-7 3 months later. And that's really how we document that. And there are different ways of tracking outcome, depending on, a 50% reduction is very significant in the field, very significant, or a 3 to 5 point drop in the PHQ-9. And so I think DIFTA is working hard on those numbers now. Any more questions?
Thank you, everyone.
Thank you.